All right, so in this lecture, we're going to talk about the blood vessels and the nerves that travel in the shoulder. All right, so we're going to talk about the blood vessels in the shoulder and pectoral regions. First, we'll talk about the subclavian, and to show you its origin, we'll talk about the heart here, and then the aorta, which is the main vessel that comes off the heart in the chest. And you have the aortic arch here, and we'll talk more about that in the thorax chapter, but one thing to be aware of is the left subclavian. So this is the left side, this is the right side. The left subclavian comes directly off the aorta. You have the left common carotid that comes directly off the aorta. Then on the right side, you have what's called the brachiocephalic trunk, which gives rise to the right common carotid, and then the subclavian that comes off here. Now, on both sides, the subclavian artery continues laterally to become the axillary artery after passing the lateral edge of the first rib. So you can see that the subclavian artery here is coming off this brachiocephalic trunk here. Here's the common carotid artery going up to supply the brain. And then you have the subclavian artery here traveling here, and then after it reaches the lateral edge of the first rib, then it goes on to become the axillary. It's still the same structure, same vessel. It's just it's named for differently depending on what region it's running. And then after it passes out of the axilla, which is basically the armpit, then it becomes the brachial artery in the upper extremity. Now, there's some branches to be aware of. First, we have the vertebral artery. We talked about this in the spine lecture. So here's the vertebral artery. This is a beautiful picture. Here's the subclavian. This is brachiocephalic here. Okay, common carotid going up here. We'll talk more about that in the head and neck region. So here's the vertebral artery going up through those transverse foramina of the cervical vertebrae. Then you have the internal thoracic artery, which then comes off the subclavian and goes down this way on the inside of the breastbone in the chest. Then you have the thyrocervical trunk, which we'll show on the next slide here. So here's the thyrocervical trunk. So here's that common carotid going up this way. Here's your subclavian artery here, okay? And so we'll label this for you here, okay? So we have the inferior thyroid, which is this artery right here. So inferior thyroid. Then it's coming up this way. Then it gives off this branch here, which is the ascending cervical. Okay, so that's this one and this one. So the ascending cervical, in a sense, it's a continuation off of the inferior thyroid. Then you have the superscapular artery, which is this one shown right here. So this is superscapular here. And then you have transverse cervical, which is here. So it's kind of in the cervical region, traveling a transverse angle here. And then next on the list we have the costocervical, which is this artery shown coming off here, just lateral to the vertebral. That's the costocervical trunk as well. That gives off arteries in the neck region. We'll talk more about that in the head and neck chapter. And then you can't see it too well here, but you have the dorsal scapular artery, which also comes off the subclavian, and that travels down the posterior aspect of the scapula. All right, so now we're talking about the axillary artery. Again, it's the continuation of the subclavian artery at the lateral margin of the first rib. It has three parts. So one thing to know is for the number part it is, that's how many branches. So first part, one branch. Second part, two branches here. Third part, three branches. So that's how you can remember that. Now, the first part travels just above the pectoralis minor muscle, and it has one branch, which is just shown here. This little branch coming off right here, superior thoracic. Okay. Now that's coming up. Now the pec minor's kind of peeled away here to give you a good deep view here. Second part travels behind the pectoralis minor and has two branches. So the thoracoacromial trunk, which is this guy right here, kind of coming off here and bifurcating. Then you have the lateral thoracic artery, which is this branch right here, which comes down like this over this, and it descends on the serratus anterior muscle here. It actually descends inferiorly with that long thoracic nerve, which is a nerve that comes down and innervates the serratus anterior. So this is something that people can confuse a lot. So it's a long thoracic nerve, lateral thoracic artery. Those two travel together. Then you got the third part, travels below the pectoralis minor. So all of this is behind the pectoralis minor. So if you're in a dissection lab, you're going to have to peel back the pectoralis minor to get access to all this, and you'll get a nice, beautiful view of all these structures. Then you got the subscapular artery. Okay, so the subscapular artery is this branch right here. So that's the subscapular. And the subscapular immediately bifurcates into two branches, the thoracodorsal, which is this one shown here, and this circumflex scapular artery as well. And we'll talk about that more in the next slide. Then to finish this out, we have the posterior and anterior. So the posterior comes off, branches off here. They're kind of hard to see. Even in a cadaver, these are going to be tough. You got to dissect deep into the axilla here, and then the anterior comes off here, and then they go deep into the shoulder region and then wrap around the head of the humerus. So give you a little more zoomed in picture here. This subscapular artery, which is this guy right here. This is the brachial plexus, by the way. It surrounds the axillary arteries. We talked about the brachial plexus lectures. So then you have the scapular circumflex artery here, coming down this way right here. So this comes down, bifurcates and this turns posteriorly to kind of wrap around the scapula. Then you have the thoracodorsal here, which then runs to perfuse the latissimus dorsi muscle, and this travels with the thoracodorsal nerve. So just to read through the text, again, curves around the lateral border, travels in the floor of the triangular space. It does not travel through the triangular space. Actually, nothing travels through the triangular space. And then it forms anastomosis with the transverse scapular artery and the dorsal scapular artery in the infraspinous fossa, which is that depression in the back of the scapula where the infraspinatus muscle is, and that's on the posterior aspect. Now, this is a good view here. You have that dorsal scapular coming down here, and this is a good picture of the scapular anastomosis, which we'll go over in much more detail. Something else we'll point out here, so you have the anterior humeral circumflex artery flexing around here. You have the posterior here. So these are also good views of these arteries as well. Thoracodorsal artery, so again, just to repeat it, it's this one coming off here, travels with thoracodorsal nerve, supplies latissimus dorsi. Humeral circumflex arteries. One thing to point out about the posterior humeral circumflex artery, it travels with the axillary nerve, so it's shown right here. Okay, so this is the posterior circumflex artery traveling with the axillary nerve through the quadrangular space. Then with the nerve, it wraps around the surgical neck of the humerus. So that's this part right here. Axillary artery, again, it's surrounded by the brachial plexus. You can see that here. These are the different trunks. Here's the median nerve. This is the ulnar nerve coming off the medial trunk. This is musculocutaneous coming off the lateral trunk. And then after passing the inferior border of the teres major muscle, it becomes the brachial artery. So you can see that right here. Teres major is in the posterior area, so it's not, you can't see it too well here, but in a cadaver you'll definitely see it. You'll be able to make that distinction, and then it becomes the brachial artery. So again, subclavian, then axillary, okay, then brachial, okay. All the same structure. It's all the same structure, all the same artery. It's just named differently for what region it's in. So the scapular anastomosis, it's a connection of arteries around the scapula that helps to bypass an occlusion or a blockage in the second part of the axillary artery, which then helps maintain blood flow to the third part of the axillary artery, their most distal portion of the axillary artery, which then helps ensure that the upper extremity continues to be perfused. Okay, and then this is a good diagram. This is a posterior view of the anastomosis that occurs. And what this anastomosis involves is it involves reversal of blood flow through the subscapular artery. So the subscapular artery, if you remember, that's this artery here that branches inferiorly off of the third part of the axillary artery. So this would be the third part. And if we draw a diagram here, so if we blow this up, this is your axillary artery. And then here's your subscap coming off here, okay? Subscapular artery. If blood flow usually comes out of the axillary artery and goes down, and then it comes down this way, and then it's going through into the thoracodorsal, and then the circumflex scapular artery. What happens is that blood flow actually reverses. So for this anastomosis to work, the blood flow is actually coming from the posterior or anterior portions of the anastomosis around the scapula. So the blood flow is coming back up through the subscapular, enters into the third part of the axillary artery, and then continues on to perfuse the arm and the hand. So that's the key concept to understand here, that blood flow is not leaving the axillary through the subscapular to go on to the thoracodorsal and circumflex scapular, it's actually coming from either the circumflex scapular or the thoracodorsal via two pathways in the scapular anastomosis and coming back up through it to enter the third part of the axillary artery and then return blood flow to the upper extremity. So these pathways, what do they involve? Okay, there's two of them. There's an anterior pathway and a posterior pathway. Okay, so let's start with the anterior pathway. So the anterior pathway, it just starts with the subclavian. Okay. Subclavian gives rise to the thyrocervical trunk. Okay. Then the thyrocervical trunk will give rise to the transverse cervical. So let's draw that up here. So transverse cervical. And then the transverse cervical gives off the dorsal scapular artery, which is also called, as it's labeled in this diagram here, the descending branch of the transverse cervical. So it goes here, your dorsal scapular, it comes down this way, so blood flow is going this way. And then after it goes through the dorsal scapular, so it makes its way down, comes down this way, then it goes through the thoracodorsal artery, okay? So that's going to go through this region here. So here's your thoracodorsal. And then it makes its way eventually back to the subscapular artery, which is shown here. So termination of subscapular. It's going to come back in here. And then if you remember, you have your axillary artery coming in like this, subscap like this. Blood flow is going to come back up, return through the subscapular into the axillary artery, and then go back out. So that last part is a good dorsal scapular to thoracodorsal, subscapular artery, third part of the axillary artery. So the posterior anastomosis, if we show this here, so you have subclavian coming across like this, so subclavian gives off that thyrocervical trunk. Gives rise to the superscapular, which that superscapular artery, just to review, it travels with the superscapular nerve, and there's that scapular notch, if you remember, like this. And then the nerve travels in the scapular notch. And then there's this transverse ligament that goes across the scapular notch. And then the superscapular artery travels above the notch. So artery above. So A and A, artery above. That's how you remember that. Then it travels through the supra and infraspinous fossa, which is where supraspinatus and infraspinatus are housed. Then on the posterior aspect, it forms these connections, or this anastomosis network, with the intercostal artery. So on this side of the rib, you have the just anterior to the scapula here, you have these intercostal arteries that are coming with the ribs. They travel in the inferior portion or inferior surface of the ribs, okay? So these are your intercostals. And then this superscapular, so it's forming connections with those, okay? Then it's also forming connections with the dorsal scapular artery, which is this descending branch of the transverse cervical. So it's rejoining in with here, and then it comes back around. And then it's also forming connections with, eventually, with the circumflex scapular artery, which is shown here, okay, or scapular circumflex, okay? And then it empties into here, and then the scapular circumflex artery goes back into the subscapular artery, which then goes into the third part. So if we show here, axillary artery, third part, then you have the subscap coming in like this. The blood flow is going to come back into the third part, return to the axillary artery, and then go down into the upper extremity. Now, what's important to know is ligation or inclusion of the axillary artery distal to that subscapular artery will result in cutting off blood supply to the upper extremity, because at that point you're distal to any chance of rerouting blood flow through these anastomosis networks and then back up through the subscapular artery into the third part. So if you go distal to the subscapular artery, you'll result in cutting off blood supply to the upper extremity due to lack of collateral circulation. All right, now we'll talk about the nerves. So first we'll talk about the dorsal scapular nerve. That's shown here in this region, so you can see it coming down here. It originates from the C5 cervical spinal nerve, comes right off the spinal nerve. First, it pierces the middle scalene muscle, which are muscles that the scalenes are three. There's the posterior, middle, and anterior scalenes, which are muscles in the neck region. Then it descends deep to the levator scapula muscle and the rhomboid muscles, and it gives off branches innervating all three of these muscles. So rhomboid major, minor, and then the levator scapulae. Travels with either the dorsal scapular artery, which is a branch off the third part of the subclavian, or the transverse cervical artery, which comes off that thyrocervical trunk. One thing to note is if the dorsoscapular nerve was to become compromised, you have denervation, that would result in the ipsilateral scapula being noticeably deviated laterally from the midline compared to the other scapula. And again, that's because of that innervation to levator scapulae muscle. This isolated nerve injury is very rare. It's usually, you'd have this deficit with a much more serious injury involving not only the dorsoscapular nerve but several other nerves as well. Now, the superscapular nerve, what does this do? It arises from the upper trunk of the brachial plexus. So you have the upper trunk is C5 and C6. It forms here. So you have the upper trunk, we'll call it UT. And then so off of that is superscapular nerve, okay? It runs deep to the trapezius muscle, and it passes through the scapular notch, which you can see a very good picture of it here. So this is your scapular notch, and we'll blow this up for you. So you have a scapula like this, and you have this notch here like this. This is the notch. And then you have this transverse ligament that goes across, what kind of bridges the notch. And so the nerve travels underneath. Like we talked about, superscapular artery goes above the ligament. Then after it travels out of the scapular notch, it enters the supraspinous fossa of the scapula, where it innervates supraspinatus muscle, which you can see right here. Now, after it travels through there, then it enters into the infraspinous fossa, which you see here, and then it innervates infraspinatus. So it innervates these two muscles. Now, in this scapular notch, so if we blow this up here, we draw it again. Got this ligament coming across here, nerves coming up through here. It can become impinged in here, and a result of that can be the transverse scapular ligament becomes inflamed, so this becomes all inflamed and puffy and pushes on the nerve. You can have a ganglion cyst in here, which is often associated with labral tear, so tearing of that fibrocartilage structure that surrounds the glenoid fossa, or you can have fracture callus. So if you fracture the scapula and you develop kind of some callus bone here, that can press on the nerve as well. Now what happens? You have supraspinatus weakness. What does that result in? Weak shoulder abduction to 90 degrees, forward flexion, and internal rotation. Now why is that? Because it innervates supraspinatus and infraspinatus. And so what you've lost with supraspinatus is you've lost the ability to help with begin abduction and then continue it. And then also it helps prevent forward flexion, internal rotation. Infraspinatus weakness, that will result in weak external rotation of the shoulder. And so if you remember, muscles contract, so it contracts in here, it shortens, it's going to pull the shoulder out that way. So external or lateral, also known as lateral rotation. Now, prolonged entrapment can result in atrophy of both of these muscles, because if you're losing any stimulus, you're losing an innervation. There's nothing stimulated in the muscle, and they're just sitting there idle, and so eventually they'll just develop atrophy. Now, the superscapular nerve, what else is important to know? It leaves the supraspinous fossa via this greater scapular notch, which you can see here in the spine of the scapula, and that's how it makes its way onto the infraspinous fossa to innervate the infraspinatus. Nerve to subclavius, it's also known as the subclavian nerve, and it's labeled here that way in this diagram here. So the subclavian nerve coming off this way, and as you can see, it goes directly to this muscle, the subclavius. Now, where does it originate? It originates from the junction of C5 and the C6 spinal nerves. Then it descends anterior to the subclavian artery. You can see that right here. It's coming down across the subclavian artery. And then it goes posterior to the clavicle. So the clavicle is kind of cut away here, but you get the idea. And then that's how it reaches the subclavius muscle. So then you have the upper and lower subscapular nerves. And one thing to note here is, if we look at the diagram, you have the subscapular nerves. You can see them both traveling in here. They're not named because one comes from the upper portion of the brachial plexus and one comes from the lower. They both come from the same portion, which is the posterior cord. The upper subscapular innervates the upper portion of the subscapularis muscle. That's obvious enough. Lower subscapular nerve innervates the lower portion of subscapularis, and it also innervates all of the teres major muscles. So it has two innervations, the lower part of the subscapularis, and then all of the teres major muscle. And this is something you want to be aware of because this is something where they might try to trick you. They think, oh, it's subscapular, all it does is subscapularis. Nope, wrong. Also does teres major. You want to be aware of that. So the thoracodorsal nerve, it's also known as the middle subscapular nerve. It's also used to be more commonly known as the long subscapular nerve. As you can see in this diagram here, it's labeled as that. But really, it's all the same names for the nerve as many other things in anatomy can have multiple names. So most classes, most board exams are going to refer to as thoracodorsal nerve. So that's what the term I would use, and that's the term we will use. So the thoracodorsal nerve, it arises from the posterior cord on the brachial plexus, and it goes between the origin of the upper and lower subscapular. So if we have our posterior cord here like this, PC, you have the upper coming off here. Then you have thoracodorsal coming off here. Okay, and then you have lower subscapular here. Okay, so that's also why it's called the middle subscapular, because it's in the middle. It's between the upper and the lower. It descends posterior to the axillary artery. So as you can see here, here's the axillary artery, and then it's descending behind that, and then it reemerges here. And then it travels with the thoracodorsal artery to supply the latissimus dorsi muscle. So it's traveling here, and then at this point, the subscapular artery comes down here, gives rise to that scapular circumflex, which goes that way, and then you have the thoracodorsal artery that comes down, travels with the thoracodorsal nerve to supply latissimus dorsi. The medial pectoral nerve, so this arises from the medial cord of the brachial plexus. If you remember, medial and lateral pectoral, they're not named for how they travel in the spatial relationship. So the medial pectoral comes off the medial cord, lateral pectoral comes off the lateral cord. We'll talk about lateral pectoral on the next slide. So what does it do? It descends posterior to the axillary artery. So you can see that here. Subclavian, it eventually becomes the axillary. Now, what's labeled here is you have the anterior thoracic nerves. So that's another name for the medial and lateral pectoral nerves. So the medial pectoral descends posterior, then it curves between the axillary artery and the vein, and then it enters the deep surface of the pectoralis minor. Because if you remember, that pectoralis minor is just anterior to the axillary artery and helps kind of actually form those. It helps you delineate those different parts, the first, second, and third part of the axillary artery, and then it provides the innervation. So what you can see here is there's some branches going to pectoralis minor. Then there's also some branches of the medial pectoral nerve, and you'll see this in the lab. This is a great landmark for not only the nerve but also the muscle. This is a great thing to find. It's often tagged on anatomy practicals. So it goes through in the branches, and then they pierce the pectoralis minor muscle, and then they go on to innervate the sternocostal head of the pectoralis major. So the pectoralis pec major here is reflected, okay? And you have pec minor. So it's few fibers go through pec minor, innervate it, and then go on to innervate pec major. Next, we have the lateral pectoral nerve, and again, lateral pectoral, lateral cord of the brachial plexus. Okay, again, just like medial pectoral, descends across the axillary artery and then the vein, and then it pierces the clavipectoral fascia. Okay, so it's coming across here, and then as you can see, so this was medial pectoral, this is lateral pectoral coming here off the lateral cord. And since it comes from this side, it travels over the subclavian versus deep to it, like the medial pectoral. So it comes this way, travels along the deep surface of pectoralis major muscle, and provides its innervation. It also functions as a major source of pain, and because of that, it's often anesthetized during surgical procedures in the pectoral and axillary regions to help prevent, postoperative pain and in these patients. And so you have this would be shoulder surgery, breast surgery, any kind of surgery in this region. Okay, so one thing to note here is that pec major is duly innervated. Okay, it receives innervation from both lateral pectoral nerve and medial pectoral nerve. So you have the long thoracic nerve. Now this arises from the anterior rami of the C5 through C7 spinal nerve. So this comes right off the spinal nerves. What we'll show here is the long thoracic nerve here, and then as you can see, it's coming down. You don't get a great picture of it coming off the nerves in this diagram, but you can see it coming down here in more the shoulder pectoral region. It descends posterior to the brachial plexus. So here's the brachial plexus here. You can see it traveling behind there and the axillary vein. Then it runs inferiorly on the surface of the serratus anterior muscle. So here's the serratus muscle, this big sheet-like muscle along the thoracic cage here that inserts onto the scapula and helps protract or pull the scapula forward. and then it provides the innervation to the serratus anterior, so it travels down along here. So the axillary nerve, it courses posteriorly with the posterior circumflex humeral artery, and it passes through the quadrangular space. Okay, so first thing, the axillary artery or axillary nerve, it comes off. It's a terminal branch of the posterior cord. So it's the radial nerve and the axillary nerve. So the axillary nerve, it comes out of the shoulder region in this quadrangular space with the posterior circumflex humeral artery. So it's a space found in the posterior shoulder. Now the borders, this is a very common, more so anatomy test question than so much the boards, but it's a good thing to know. So especially for your class exam and just understanding the anatomy. So the first border is the long head of the triceps medially. So here's triceps here. Here's your long head. So this is the medial. The shaft of the humerus laterally, so you can see the outline of the shaft of the humerus here. That's the lateral border. And then you have teres minor superiorly, so that's this border right here, okay? And then you have the teres major inferiorly, okay? So again, what you have here, we'll go through this one more time. Teres minor, superiorly, teres major, okay? Then you have humerus here, and then you have long head of triceps medially here, okay? So that's your border. And then in here you have axillary nerve and posterior circumflex humeral artery, okay? Now, and those are your contents there. Upon exiting the quadrangular space, it wraps around the surgical neck of the humerus. This is very high yield, both for anatomy exams and board exams. So this is the surgical neck right here. And if you remember, the surgical neck is an area distal to the greater and lesser tubercles, and it encompasses in the proximal humerus. So that's the surgical neck. The posterior circumflex humeral artery also wraps around the surgical neck as well with the axillary artery. And then it gives off these lateral cutaneous nerves, which are shown here, and these give off, and these nerves innervate the skin covering this lateral aspect of the upper arm. Then it also gives off branches, as you can see here, going into the deltoid muscle. So it innervates the deltoid and the teres minor muscles. So you can see that here. It has a branch going up here to the teres minor muscle. The way you test this clinically is you ask the patient to abduct their arms past the first 15 degrees, because the first 15 degrees is supraspinatus, okay? So if just because they can go the first 15 degrees, that doesn't really mean anything. As long as they have supraspinatus, that's okay. If they can't go anywhere past that, then you worry about axillary nerve damage. The other way you test it, so you test the motor and the sensory component of axillary nerve, okay? And then you test the sensation on the skin of the lateral aspect, and that'll give you an idea of the integrity of the axillary nerve. So the radial nerve, again, it's one of the two terminal branches of the posterior cord of the brachial plexus. The other is the axillary. The radial nerve, for your landmark's sake, if you're dissecting in this region, the radial nerve is a very large nerve. It's much larger than the axillary nerve. That's often how you can differentiate them. In addition, you can see that axillary nerve it immediately turns and exits the shoulder region posteriorly. So that's another thing to be aware of if you're dissecting in the lab. In the shoulder region, it has a short course, like I said, then before it exits the arm through the triangular interval. So up here you have the quadrangular space, okay? Now down here is where you have the triangular interval. So what are the borders? So you have the teres major superiorly here, long head of the triceps medially here, okay? So that's the triceps, the long head there. And then the lateral head of the triceps is this portion here, and that's the lateral. And then sometimes there's some books that'll say also the humerus laterally. It just depends on their source. For your class, I would go on whatever your notes say. And then the contents are going to be the radial nerve, which comes out like this, and then the profunda brachii artery as well. The profunda brachii artery, we'll talk more about that in the arm lecture, but basically you have the brachial artery, which is the continuation of the axillary artery in the arm, and then you have this branch that immediately comes off proximally, and that's your profunda brachii. And so that's an artery also that exits through this space as well. The radial nerve, it goes on to innervate the extensor muscles of the arm, the forearm, and then also in the fingers as well, in the hand, and then it provides dorsal innervation, cutaneous innervation to the dorsal surface in the hand. All right, and that wraps up our discussion of the blood vessels and nerves in the shoulder region.